Hi, everybody. I hope you're getting acclimated to using the MyMTI site and also to using the connector LearnSmart. A couple things I want to talk about before we get into Chapter 4 is this participation form. I would like everybody to make sure that they get this filled out. I am attaching points to it. It's just a little form that Mitchell Tech needs. It's a grant-based form. So please fill that out. And then once you're done filling out the form, um, send me an email and use the snippet tool, and then send me the last portion of it that says that you've submitted that. So then once I get that, I will attach the points to you. And then the other thing I want to talk about is under news and announcements. I would like you to go a little bit further back. There is one called Remind. I would like everybody to sign up for Remind. You put it into your cell phone, it sends a message. And that way, if I need to get a message out to everybody, then I can send a mass text or a mass message to everybody so everybody will get it. So please sign up for that as well. Now, your assignments are going to be due on the 31st of January at 11:55 p.m., so don't forget your due dates for the integumentary system. So once we talk about the integumentary system, it includes your skin, which is the largest body organ that we have. It also includes your hair, your nails, sweat or sudoriferous glands, and your sebaceous glands. So first we'll talk about the skin, and I'm going to pull that up for you. There we go. And here's our skin itself. We have three layers to the skin. We have the epidermis, which is your top. Epi means upon. Here's your top layer. It's the outermost layer. That's the one that contains melanocytes, which produce melanin. And melanin is what determines your skin and your hair color. And then the second layer is your dermis, which is much thicker layer. This layer contains connective tissue, which contains elasticity for you. It contains that collagen, which provides strength for the tissue. Again, if your collagen stretches and stretches and stretches too much, this is when we start to get stretch marks. The dermis layer also contains a really good supply of blood. So these little red marks and lines here are blood supply for us. Notice there's no blood supply in your epidermis. We don't have blood supply up there, but we do in our dermal layer. It also contains hair follicles. Here's my hair follicle coming out here. And then we also have nerve endings here. And we also have sweat and oil glands and our sensory organs, our sensory receptors here, as well in our dermal layer. Then the bottom layer, so this is our top layer, our middle layer, and our inner layer, I should call it, is our subcutaneous or our hypodermis layer. This is the innermost layer, and it contains this yellowish material that we call adipose or fat. Okay. The next thing we're going to talk about is the hair, and that's right here for us. We find hair in most areas of the body. Parts of the hair are the hair shaft, and that's the part that protrudes out from the skin, and that's the one that we see. Hair growth, the thickness and the curliness of your hair is all going to be determined by heredity mostly. If we talk about baldness or alopecia, that's another word for baldness, it can be a result from some type of emotional trauma, maybe poor nutrition if you're not eating correctly, some type of disease. Maybe you're taking some type of medication. You can have a reaction to medication that causes you to lose your hair. Radiation and chemo are another cause for having alopecia. You'll lose your hair. Nails are our next one that we're going to talk about. Nails form from the nail root and are made of a hard keratin is what we call it. Parts of the nail are going to be your nail body, the lunella, which is that half moon at the base of your nail. We also have what's called the cuticle, which is that thin band that surrounds the edges of your nail. Then if we talk the different types of glands, we have here our sweat glands. And we have our sebaceous glands as well in here. And the sweat glands or your sudoriferous glands is another name for it. They secrete outwards to the body, outside of the body through ducts called exocrine glands. Then we also have what's called eccrine glands, which are your small sweat glands. Then the sebaceous glands, the sebaceous ones are right there. They secrete oily sebum found at the base of your hair follicle. So that's what gives your hair that moisture that it needs. Then if we ever have any problems with our skin or with our hair, we go to what's called dermatology. It's a field of medicine that studies the diagnosis and it treats the problems of the skin. We go to see a dermatologist. If we talk about the diagnosis, procedures, or tests that can be done, there's things called a patch test, a scratch test, and then there's an intradermal test that we can do. It's where we stick in, we don't stick, but we inject an antigen between the layers of the skin. This test is mostly done when we do a TB test. And I'm going to see if I can move down here and show you that one. There we go. And that's done to test for TB, and it's called a mantle test. It's one of the tests done, we inject it intradermally right underneath or right beneath the skin, and we look for a small wheal or an induration. If we talk about pathology terms, different types of abnormalities that we have in the skin, we have what's called lesions, which are tissues that have changed because of some type of pathological condition. We have vascular lesions, where blood vessel lesions that show through the skin. On page 79 of your textbook, it also shows this very same page for you. So you can look here, or you can look in your textbook as well. It shows the different types of lesions. We have primary lesions, we have secondary lesions, and we have vascular lesions. Okay, some of the most common ones we see, I'm just going to name a few here. We have a macule, which is a flat or flat one. You can't feel it. It's also another word for that would be like a freckle. Then we have a papule, which is one that we also call a pimple. Then we have a bulla, which is right over here. That's a large blister. And a pustule, which is a small elevated mass that would contain pus. Different types of other ones are like cysts that can be solid or they can be filled with some type of fluid. We have what's called a pineal cyst, which would contain hair in it. We also have sebaceous cysts, which contain the yellow sebum. Secondary type lesions that I want to talk about is erosion. This is one. That's where the skin is worn away by some type of friction, like if you've had a rug burn or something like that. We also have what's called a fissure, which is a deep furrow or crack in the skin. We get those sometimes in the wintertime when our hands get very dry. We get those cracks. Then there's ulcers. And I don't have a picture. Oh, here's the ulcer right here for you, which is a wound with loss of tissue. You can see a deep hole here. Different types of ulcer. There's the decubitus, or it's also called a pressure sore. Those are chronic ulcers, usually seen over any type of bony parts. Your buttocks, your heels, your elbows, anything that's a bony surface. We usually see this in people that are bedridden. I'm not going to go into your vascular lesions, but other types of skin conditions we might see are viral rashes. We have rubeola, which is your measles, rubella, which is your German measles. We have the varicella, which is chickenpox that's caused by the varicella virus. Other types of skin conditions is like if you get a staph infection, which would be like an impetigo, which is highly contagious. A fungal condition, some of those would be like a ringworm, athlete's foot. Different types of viral infections. We have herpes simplex virus type 1. The type 1 would be like a cold sore or a fever blister. Those we see mostly around the mouth. Then there's herpes simplex virus 2, which is our genital herpes. And then we have the third one, which is herpes zoster. This one's also called shingles. Appears later on in life with people who have the chickenpox virus within them. And then in times of stress, they might have an outbreak of the shingles. Other types of skin conditions you may see are acne. Usually that starts around puberty. That can contain pus or fluid. It's just an overproduction of sebum. Psoriasis is another skin condition. It's just scaly lesions on the skin. Usually it's associated with some type of stress. Usually we see psoriasis, it's a scaly patch that gets worse in the wintertime. There are medications out there to help with psoriasis, so it's not something that you have to live with. Seborrhea is just an overproduction of sebum. You think about rhea means flow, it's just an overproduction of sebum. Then we're going to move into burns. Burns, we have first, second, and third degree burn. They are going to be classified by the depth of the burn. I think about everybody's probably had a burn in their lifetime. The first degree burn is the first one we're going to talk about. And I think we have a picture of the body here. And again, we talk about the different types of burns that are classified by the depth of the burn, and when we define what where the body has gotten a burn, we use what's called the rule of 9, and that's what we're going to that's showing you here. But our first degree burn is what we call a superficial burn. There's usually just involving the epidermis. Usually you see redness and swelling with it, but you're not going to get any blistering with it. So that's just your superficial or your first degree burn. Our second degree burn involves the epidermis and the dermal layer. This one and your second degree, you're going to see blistering with that one. And your third degree burn, that is complete destruction of the skin. That's going to go all the way down to the muscle, possibly even the bone. This type of burn will leave scars on your body. Other types of skin conditions this one can be caused by insects. Pediculosis is lice infestation. Usually we see this on the head. Then we can talk about scabies, which are caused by mites. Now moving on to neoplasms. Neoplasms can be malignant, and another word for malignant is cancerous, or they can be benign, which is non-cancerous. If we look at benign neoplasms, your most common ones are called calluses, which are hard, thickened areas of skin. Usually we see those on the hands and feet. And again, if they start to crack, get those hard pieces of skin and then they crack, they'll get those fissures in them if they get really hard and thick. Another type of benign neoplasm would be a corn, which is hard, thickened skin that we see on the toes. The other type is malignant neoplasms. Again, malignant means it's cancerous. So an example of that would be a melanoma. Oma means tumor, and melan would be on your skin, so it's a cancer of the skin. Skin grafts is the next thing we're going to talk about, which is a repair of the skin, most likely coming from a burn. We have autograft. Auto means self, so we're using the skin from one's own body. Then we have allograft or homograft. Homo means same, so we're using a donor skin from another person, but it's still coming from a person. Heterograft or xenograft, we're using donor skin from another species to another. Usually we're going from pig to human. The other thing we're going to talk about is plastic surgery to remove some type of growth or to scrape the skin. There's a cryosurgery. Cryosurgery removes the tissue by using cold liquid nitrogen. There's a dermabrasion, which uses brushes and emery boards to scrape the skin to remove wrinkles, scars, and tattoos. Then we have dermabrasion, removing dead tissue, and cauterize. We use the cauterization, it burns the tissue to stop bleeding. Then the last thing we're going to take a look at is your pharmacology terms. We have an antihistamine, which are medications to block allergic skin reactions. Anti means against. We're going to block the histamines. Histamines are in the body, which elevate when we have some type of allergy reaction. Antibiotic, what they do, they slow the growth or they kill microbes that are on the skin. Antiseptic is another thing. It works the same as your antibiotic. Antibacterial, it slows or it kills the growth of bacteria. Antifungal, they slow or kill fungal infections. Again, anti means against. We have anti-inflammatories. Anti is against, which reduces inflammation. Different types of anti-inflammatories. We have antipruritus, which stops itching. We might have some type of condition that causes itching. So if you take an antipruritic, which stops the itching because those nerve endings are right on the surface of the skin. So yeah, that's why you get that itching. Then we have antiseptic, which stops the pain on the skin. Ana is without, and that septic is that feeling, so without feeling, so that's what that one means. So those are the terms and the words that for this chapter that I wanted to go over with you. So if you have any questions, you can always get a hold of me. Otherwise, best wishes on doing your homework. Remember, we have homework in my MTI and out on the Learn Smart. Thank you.